Happy Friday, everyone. It's Wynn Brown here with Haywood Healthcare's COVID-19 wrap-up for Friday. Today is June 12th. Looking forward to the weekend. Hopefully everybody is going to get some level of time at home with their family and take advantage of the summer weather that's here. As you know, from Wednesday's email, we announced that we're going starting next week to 3-day-a-week updates, Monday, Wednesday, and Friday. And on Friday, we'll just wrap up the week, and then we'll be back to you on Monday. So let's jump right in like we usually do with our statistics. We have tested 6,149 individuals, 5,501 negative, 499 positives, 74 indeterminate. Our cumulative rate throughout the pandemic is 8.2% positive, and the state is at 15.4%. Our 10-day rolling average is at 1.82% versus the state at 3.75%. And there are a couple of charts that are embedded with this email so you can see the rolling average trend and that bell curve, as well as the number of positives on a daily basis. So you can check that out for those of you who are interested in the visual data, which really helps understand what's going on when I just throw some numbers out at you. Across the state, 104,667 positive cases throughout the state, and in Franklin County, 11,885 positives, and Franklin County, 348. So those numbers are just inching up very slowly now, just like in our region as well, which is a great sign, and you can see those trends on the charts that are with us. At Haywood, we have 2 positive inpatients, one in our ICU and one on Watkins 1, and 3 patients under investigation, which you all know means by now that we are awaiting their test results to come back. A summary of announcements. The governor, of course, announced phase 2 of the recovery for the state on Monday, and that has allowed us some additional flexibility for elective surgery, reopening some of our elective procedures like mammography and other modalities like that. And it also, we're going to look at our visitor policy again. We're looking to make sure we have adequate staff for especially the Haywood main entrance, and we really want to get the south entrance open. And so we've had a number of people apply for door screening, EVS, and security positions, and I encourage you to take a look at our website if any of those speak to you. Also, college students or high school seniors who might be interested in door screening, that is available as well, and just hop online and fill out an application, and we'll see if we can fit you into the Haywood family and get you on our team to help us, especially over these summer months as we continue to transition. And again, it's very challenging for us from access control, especially at Haywood Hospital with our legacy hospital facility that was not designed to do this. Our waiting rooms were not designed to be large enough for social distancing like we're trying to do. We're trying to queue up patients in a manner so that we are safe for everyone. And I appreciate everybody's patience on that, both staff, visitors, and patients. So thank you for that. Also remember that we have new screening questions, so especially if you have been here before and you think that you've already answered those questions once, we have a larger set of questions, and if you're a staff person, you are self-attesting to that when you come into the facility, and make sure you have your mask on and that you gel in and gel out, foam in and foam out, depending on what product you're using, and just make sure that we're all being super safe as we can be for our colleagues and for our community and patients. Also, as I announced earlier, MRI services at Haywood and Athol go back to their normal schedule next week, as do mammography, calcium CT scoring, bone density, all on Monday are back to their full schedule. So that is great for us. We can serve the community and make sure that we can call our staff back and get up hopefully to full speed again and keep the pandemic low so that the governor doesn't roll anything back on us. Again, community testing is up and running 7 days a week. If you're a community member or a staff member who wants to get tested for COVID-19, you just have to call 630-6186 to schedule your time. It happens at Tully Urgent or Walk-In Care, and also the primary location for that is at Haywood behind the Annex building across the street. We have a tent set up for mobile testing there as well. And so encourage you all, if that's something you want to do and want to know about, we'll do that. Also, we announced that we will be bringing antibody testing in-house in about a week. We're getting our labs equipment and systems validated, and that will create a much faster turnaround time. We will also be bringing our COVID-19 testing in-house hopefully sometime this summer, as soon as we get an allocation of the testing supplies, which we have not received an allocation yet, but we do have the equipment to do it. We just need to be supplied everything we need to do that for our community, and that'll be much better than the 48 plus hour turnaround time that happens because we send things to our reference lab. We had a moment of silence across the health system this week to show solidarity for the systemic racism in our country. I was really proud of our organization to do that, and I hope that that was meaningful for staff and visitors who were in our facilities at that time. And I just continue to pause and reflect and pay attention to the news and be good listeners and educate yourself on what is going on and why, so that we can be supportive of change systemically in our communities. We also got a $650,000 Mass Up grant from the Health Policy Commission to address food system efforts and economic empowerment in the town of Winchendon. You've heard me talk a lot about the food insecurity work that we've been doing across our region, and hopefully you're all familiar with our weekend food backpack program, which has transitioned this summer to serve 650 families a week. And really, Winchendon is what we call one of those food deserts. It does not have a supermarket access to adequate fresh food. And so we've been working collaboratively with a number of organizations to figure out how to tackle that. And we were one of 4 recipients of this statewide grant out of 22 applicants, incredibly competitive. And I think one of the reasons that we got that is our track record of community service and tackling issues around health and social well-being. And so a shout out to all the Haywood family that made that possible because of the good work we continue to do. There is a link here as well for staff. I already talked about door coverage, but we do have some shifts open, so you can click on the sign up Genius and see if that's something that you want to pick up a couple shifts on. Please do that. From the kitchen at Haywood Hospital, the cafeteria, we are resuming new hours on Monday. Breakfast 7 a.m. to 10:30 a.m., lunch 11:30 to 4 o'clock, and dinner 5 p.m. to 6:30. And again, we have a refrigerator stocked for our overnight staff as well. I have had some questions from people like, well, we get a free meal every day, which is fantastic, and it's truly appreciated. And it's just one of the small gestures that we can do to support everybody during this pandemic. They want to know how long it's going to last. We expect to transition back to paying for your meals when the governor opens up restaurants for inside dining completely, which is in phase 3 or so of his plan. So we'll keep a tab on that and let staff know when we're going to transition out of that program. But for now, it's all systems go as the way we have been doing it. And just a shout out and thank you to the organizations who supported all of you with food across the health system this week: the Williams Restaurant, the Gardner Ale House, Blue Moon Diner, and the Boys and Girls Club of Leominster-Fitchburg, who made a donation of face shields that they had made on their 3D printers, which is really awesome. And just a reminder that our format changes next week, 3 days a week for this report. We'll push it out through Constant Contact, so you don't need to remember. And just finally, the Winchendon Health Foundation, which is a funder in the town of Winchendon that is affiliated with the Winchendon Health Center, but an independent organization, announced their annual John E. Harrington Healthcare Scholarship, and that is going to Rebecca Lynn Bergeron. She's a 2020 graduate of Murdoch High School, and she's going to the University of Massachusetts at Dartmouth in its nursing program. So we wish her well and good luck in her studies, and hope she comes back to the community to practice and take care of everyone in our region. And we'll look forward to try to find a way, if she needs to do internships or those types of things, to get clinical experience so she can do that close to home if that's something she wants to do. So wishing you all a wonderful weekend. Thank you for the incredible work you're doing to care for our community, and to the community who sees this, thank you for continuing to support us as we continue our journey to be one of the best community-owned health systems in America. Take care.